I am Marvin Cameron, and this is the Conduit. It is Monday, April 12, 2021. Beautiful day in Kitsap County. Have a great interview today. It is 12 noon, about 56 degrees. Happy Monday to everyone out there. As you know, today is my favorite day as everything gets started. Today I have Holly Bolstad from Kitsap Public Health. And I'm going to go ahead and bring her in because we are so looking forward to having a conversation with her. So let's see if we can't get her to join in with us. All right. So hopefully everyone is having a good day. I know that, as I said before, it was a really busy weekend this weekend, and but definitely fruitful. Learned a lot, and which is great. Love that. I think that is fantastic and always good. And we're trying to get Holly in right now, so just bear with us. Working on it. So, we're using this new program here, which I think works really well. And so now we just got to make sure that we can see Holly, because, that's kind of important, right? Got to be able to see the person. For sure. Okay, that sounds good. She's gonna try to join from her cell phone because she's on a government computer, so that could be causing some issues, especially, you know what, that probably is it with the camera and whatnot. Yep, there we go. You got it. It was your government computer that was doing it.
Sorry.
I was like, you can't use the mic, you can't use the camera, you can't use any of that stuff.
It's like, no, not allowed.
Nope, that's it. I'm like, wait a minute, everything was working just fine the other day, and it's like I could see you, but no camera, no mic. So welcome. How are you doing, Holly?
I'm okay. It's Monday, so here we go.
No, it's Monday. I was just telling everyone Monday is my favorite day. I love Mondays.
Why?
Well, it's the day that everything gets started. So, you got your weekend, and, I'm always chomping at the bit to, do work and just, interact with folks. So I always get excited and jazzed up about Mondays.
Mm-hmm. It's a clean slate. That's true. Kind of.
Yeah. Fridays are more of a downer for me, although I look for them,
You're like, I'm looking forward to this, and now it's here, and now I have all this pressure. I have to do something fun.
Well, there's a lot that we want to talk to you about. I've already submitted you the questions. I also wanted to talk to you about the vaccine event that took place at the Marvin Williams event on Saturday, which we were down there and a part of, and then the big event on May 1st. And also I think we wanted to talk about the declaration, the racism and public health crisis. That's something that we're going to talk about also.
Yeah, that'd be great.
Perfect. So this takes a while, so I hope you have some time. How much time do you have?
Let's see. I have another meeting at 1. So
at 1? Ooh, all right. So then we will rapid fire some of these questions and maybe have you back for part 2 if you're willing to do that. How's that?
Let's see how this first goes.
Oh, you know what? It's all good. You're already wonderful and great. So the first question is, Black History Month has passed. We're already in April, but what does Black History Month or just Black History mean to you?
To me, Black History Month is about filling some of the gaps and holes in our public education system and doing the educational work around realizing and understanding how much Black people have contributed to our culture and nation and society, and explicitly naming those and learning about those individuals throughout history, I think is really important, especially considering the omission from our public education system and how that's intentionally not built in.
Yeah, absolutely. Absolutely. Homelessness is a really big issue nationwide and in our county. We also have a moratorium on eviction that is getting ready to end. Just from a county perspective locally, what are some things that you think we should be doing to help to reduce homelessness?
I think homelessness is inextricably linked to public health, and so working at the public health district, I think there's a clear link between those things, and housing is healthcare. We know that when folks have consistent places to reside, that they have better educational outcomes and job outcomes and healthier, happier lives. So I think in terms of what specifically we could do in Kitsap to better address that, I feel like I am not well versed enough in what's currently being done to really speak eloquently or like in any specific detailed way about that. But I think one thing in general that could be done across the nation is more of a focus on permanent supportive housing. I think shelters are a tool and they serve a purpose, but too often they're seen as kind of like the silver bullet, or like, look, we have all these shelter beds available, but it's like, that's not a long-term solution. And also there are a lot of restrictions on shelters. So I'm not going to think any differently of someone if they don't want to go into a shelter because it means being separated from their children or their partner, or there's, I don't know, a lot of restrictions tied to shelters too. So I think more of a focus on building long-term permanent supportive housing would be a step in the right direction.
All right, absolutely agree with that. Would you say that speaking about minimum wage, we know that that kind of was a failed bill. There's kind of some talk about bringing it back up right now. But what are your thoughts around $15 minimum wage, and is that a health issue? Also, would you say?
Definitely. I think when the fight for 15 started, you could make a compelling argument for that being a livable wage, but $15 an hour comes out to, I think it's just over $30,000 a year, which, as we know, that's not sustainable. And even if you have a double parent household where both folks are making you're still eligible for subsidized lunch in a lot of states and counties. And so I am supportive of the $15 minimum wage, but really it should be $50, I don't know.
Yeah, I think the true like cost for cost of living somewhere around $28 an hour is really where it should be. So even if they did get it to 15, there's still a lot of folks that are suffering. And what's frustrating to me is when politicians on either side, data is numbers, but you can make the numbers say what you want it to say, right? And so it's like, oh, hey, the $600 stimulus lifted so many people out of poverty, and it's like, oh, it did it? So it's like, I think you ask those folks, and they would say, they're still suffering and still impoverished. It's just their standards of what they call poverty is woefully, low. It's a tremendously low bar in this country. I think I kind of know how you feel about the vaccine, but can you speak a little bit about the vaccine from a personal standpoint? Like, what are your thoughts on the vaccine?
Yeah, I think personally, I view the vaccine as one of the tools that we have in our toolbox of ways to fight the coronavirus pandemic. I think there is maybe too much of a focus on kind of looking towards a maskless future as kind of our carrot. And I think realistically, that's not going to happen for a while, but that doesn't mean that you shouldn't get vaccinated. I think for me personally, part of what's behind me wanting the vaccine and getting vaccinated myself is wanting to protect my friends and family. And like, I am not a high risk individual, but I have some family members that are. And so even though theoretically I could get COVID and be totally fine. I would never be able to forgive myself if I was the one who gave my grandma Esther coronavirus. And so, yeah.
So have you had any conversations with friends and family that have been wary of the vaccine and the fact that it was created so quickly, and just kind of, distrust of the government, and, just the whole money making, schema of the pharmaceutical, industry? Like, what kind of conversations have you had kind of centered around that?
Yeah, I definitely think, I think everyone should get the vaccine if you're eligible and it's accessible to you. That being said, I think if you're from the Black community, it's very reasonable to have mistrust of government and of the vaccine, given centuries of oppression and, things like the Tuskegee experiment and Henrietta Lacks, but also not just those things. It's more than that. It's Black maternal health, and it's how people get treated every time they go to the doctor. And but I do think that these vaccines were made in earnest, and there weren't corners that were cut. I think one thing that people don't understand is that normally when we do trials for vaccines, we'll do 3 or 4,000 people in the trial, and it'll be over a span of time. And these vaccine trials were like 20, 30, 40,000 people. And so just the sheer number of folks, it was on a faster timeline, yes, but because of all the cancer research that's been done on mRNA and vaccines, we're a lot further along than we have been at any other point in time. And so, yeah, that being said, there is still a lot that we don't know about the vaccines, but the first people that have been vaccinated long enough now, and no one has arms growing out the back of their heads. So, so far, so good.
Well, and I definitely count myself in that community, right? We were offered the vaccine pretty early as being first responders, in the area doing the work, and then having, comorbidities. I could have received the vaccine earlier, and I'm not gonna lie, I'm scared to death, right? I have a lot of anxiety around it, and just, not knowing, right? Because you look at, vaccines that have come into play, and just kind of how things come about, and it's like, wow, this happened so fast. Well, why aren't they doing other things to solve other issues if they can just, kind of, snap their fingers and make it so? Why aren't they doing that? And they're still making, tons of money at the same time. And so, there's that. And then there is the historic treatment and current treatment of the Black community. And I could share a dozen stories that I've had with bad treatment, with healthcare professionals, and, not believing in the ailments that I'm sharing with them. And it's one of the reasons why, I am who I am, right? I'm Marwan Cameron. And part of that is, in my everyday life, I typically wear ties 6 or 7 days a week. But when I go to the doctor, I also look the same, because if I just go in a pair of jeans or sweats, I'm viewed at differently oftentimes. And that's been my experience, where, I don't have the pain level, or I don't have the symptoms that I'm sharing, or, what they decide to do is very different than what they will do for my white friends and other folks. And so that is a real experience for me. So that has made me tremendously hesitant. And, but through conversations and sitting in on, Zoom meetings, and thank you for the invite, to public health and the research, and talking to other people that I believe in and have trust in, I am getting the vaccine now. And I'm going to do it on camera, and then track it and vlog, so that people can see just kind of what's my experience, a few hours after, the day after, 2 days after, 3 days after, in the hopes to, dispel the myths and the anxiety and the distrust, because ultimately, if you're kind of weighing those things out, there's more greater good in getting the vaccine than not getting the vaccine. Would you agree with that sentiment?
Absolutely. Yeah. And I think it is a really tricky question, because vaccine hesitancy, there's all different forms of it, right? And it's existed before COVID. And, in this country, it's kind of a separate phenomenon. And so trying to parse out how that looks in different communities and what we can do about it to address the different types of vaccine hesitancy in different communities, is something that we're focusing on and working on right now. But I think that's amazing that you're going to get vaccinated and going to record it and share it out, because I think it's really important to do that and to show folks, like, here's the process. This is what it was like for me. This is how it felt. And also knowing that, if you do feel sick for a couple days after getting the vaccine, that's okay. And that you should still get the second shot if you're getting one of the ones that needs a second shot. But I think there has been some people are reluctant to share that part of their experience because they don't want to deter folks from getting it, but really being transparent and honest about the process is really important as well.
So let me share this with you as we go into the next question. So I had agreed to take the vaccine and, come to my own, understanding on making that decision. And then all of a sudden this news comes out about the Johnson & Johnson vaccine, because that's the one that I want, right? It's like, I already hate needles, so let me just do it once and get it over with. But now I'll probably end up doing the Moderna or the other one. So I just got a phone call earlier from Kitsap Public Health to schedule it. So I need to call them back and schedule it. But then all of a sudden it's like, okay, well, and I think it was like 8 people out of the millions of doses that have already been administered were having some issues. So they pulled it. And so for someone that already has the anxiety and the distrust, it was like, oh man, should I wait? Like, what's the deal on that? But I have to look at, the actual numbers on that. And so, coming from a business background, that you have an acceptable failure rate, right? Out of a million vehicles, 10 of those vehicles or 10,000 of those vehicles are going to fail or have issues with them. And those are minuscule numbers when you look at it. And so that's nothing to be concerned about. But one thing that I am concerned about is, politicians and governments, seeming to be more reactive than proactive. It's like, okay, we want to hurry up and open up. But then we have spring break, and then, you're going to have a super spreader event, and then it happens, and it's like, oh, we need to close down again. It's like, we've gone through this for, Easter and Independence Day and Labor Day and Thanksgiving and Christmas. It's like, why can't you guys just stay on lockdown for a while, let enough people get vaccinated, and then open it back up so we're not doing this thing? What are your thoughts on that? Should we open up? Should we stay closed? Like, what should we do?
No, I mean, I'm of the same exact frame of mind as you on this one. I really think had we shut down in a serious way for long enough and people adhered to those restrictions, like in some countries, like you couldn't leave your house, and if you did, you would be stopped. You had like 20 or 30 minutes a day you could go out for exercise, but other than that, you couldn't. In terms of enforcing that kind of thing here in the US, and this is something that I think about every day and try to focus on the small wins and the positive things, because when I really kind of go down the rabbit hole of like, how does a country founded on bootstraps, individualism reach herd immunity? I don't know. I'm not sure, because 50% of Republican men still don't want to take the vaccine. And, like a third of healthcare workers don't want to either. So
that's a high amount.
That's why I say vaccines are one tool in our toolbox of ways of fighting the virus, because, I'm not sure that we're going to get there. I mean, we've kind of already missed the mark in terms of getting there fast enough to curb the spread before the virus mutates and, starts gaining some resistance to our vaccines. And that's the other thing I want to say is I don't think, COVID isn't going anywhere. We're trying to get it to a point where we can celebrate and gather and be in space with other humans again, but it's going to be a part of our lives for the foreseeable future. I would guess that we're going to have to get booster shots every year, kind of like the flu shot, because it's going to continue to mutate. So I think, I don't know if they can make a little cocktail and mix up the flu shot with our COVID shots, but I do think it's here to stay, unfortunately.
Well, and that sounds scary to people, because some folks think that they are already doing that or they will do that. So, don't get a flu shot. I mean, there's just all kinds of, crazy, dangerous rumors out there. So, well, with that said, what do we, if you're saying we're going to be with this for a while, um, are we going to be wearing masks into 22 in your personal opinion? And herd immunity, it doesn't seem like that's coming anytime soon.
Yeah, I mean, again, I also don't, and I like live and breathe this and work in this all the time. So I think I need to check myself sometimes because even now, once you're vaccinated, and friends and family members that are vaccinated, you can see each other. You can gather indoors unmasked if everyone is vaccinated, or if, like, say I'm vaccinated but my friend is not, and they don't have anyone in their pod or that they're seeing regularly who is high risk. You can hang out together and spend time together. And so I think also sometimes we confuse anxiety for caution, and
Mm.
there is something to be said for our mental health, for being able to just chill out and relax and spend time with people that we love. And so it's also important to kind of, I think one strategy that I personally do is, set up little, like, okay, I'm going to go to the Arboretum next weekend, or I'm going to go visit a friend and we're going to sit outside at a park, like setting up the little things that bring me joy has been helpful for trudging through.
Nice, nice. Well, can you answer this? Because this is a big question that I think a lot of people have. For those of us that, or I haven't been vaccinated yet, but once I am, for folks that have received both of their doses, they've had the 14 days after that second dose. Why do they still have to wear a mask if they're vaccinated? I think there's a lot of confusion around that.
Yeah, so you can still carry and shed virus after you've been vaccinated, but it's at a much, much smaller percentage of what you could before. So, for example, if you get the Moderna or the Pfizer, you can carry and shed up to 5% of the viral load that you could before being vaccinated. And so, what that means is that you can still contribute to the spread of the virus, but if you get it, you're not going to, your likelihood of being hospitalized or dying from it is basically almost nothing.
Wow.
And so it's important to still wear a mask, because if you are asymptomatic positive and you have COVID, you could be spreading it even though it doesn't show up in you, and you're not going to get really sick and die from it.
Oh, thank you, man. That is a great answer. I think that's awesome. And I haven't really heard that clearly from, Fauci or many of the other doctors and just all that. So you've made that really plain. I think that's going to be really helpful to the audience. I'm gonna skip what do you think should be done with the abandoned buildings? But can you define friendship? What does friendship mean to you? Why is it important? Your friends, what would they say about you as far as what makes you a good friend?
I had fun reading through these questions ahead of time because I was like, these are all over the place and I love it. But yeah, friendship is really important to me. It's yeah, I'm not sure, I guess, define friendship. Friendship is being there for other people, and that can mean like emotionally or physically, or just checking in and showing interest in being interested in the things that they're interested in. And yeah, I don't know, I love friends, and I love staying in touch, and I love how COVID has forced us to kind of do that differently, and also have a greater understanding and appreciation for people's humanity. Like, I have friends that I haven't talked to in over a year, and then we'll get in touch and it's like no time has passed at all. And I think that's also a really important reminder, is like, you do what you need to do for yourself at this point in time, and when you reach out to folks in the future at different points in time, that's okay. You don't need to like constantly be nourishing or nurturing or cultivating friendship, that you can take breaks. And so yeah, I don't know, I have my like inner circle of 4 or 5 folks that I talk to pretty constantly, and they are my lifeline. So
Nice. And so I think there's what, trust and authenticity. Would you say, you can rely on them? They're going to be honest with you. Are those some of those attributes?
yeah, yeah, and I think something that I learned in, I mean, the last like 4 or 5 years is that friendship doesn't always mean like blind loyalty. Sometimes it is that hard truth of like, well, actually, you are kind of this way, and it is, and that is a sign of healthy and strong friendship, and that I want to seek that out in my friendships. I don't just want the blind loyalty. I mean, sometimes I do want that, and being able to name it too is like, right now, can I just vent to you? I don't want constructive feedback. Like, I
Mhm.
support right now, and being able to identify and separate between those two things. But yeah.
Nice, nice, awesome. So let's go a little bit deeper. So when it comes to romantic relationships, what would you say makes a good, significant other? What are those attributes there, and what do you require from that person, and what should they require from you? What do you offer?
hmm Yeah, I think this is something I think about a lot in, I think, trying to differentiate between like interdependence and codependence, and how kind of the status quo or the socialized norm is to be codependent on your romantic partner, and how that's something that I'm constantly examining and trying to interrogate and disrupt in my own relationships, and get away from that, but also be okay with being like reliability is really important in just like being able to know that you can call someone if your car breaks down or if something happens, and they will be there for you, I think is really important. While also leaving space for humanity, and like, sometimes people are unreachable and you can't do that. But yeah, consistency, reliability, I think those are important. And then also, I really value alone time. And so finding partners that are okay with that is.
I'm right there with you for sure. That is tremendously important. Um, what is something that people may not know about you? Something interesting, a little different than your everyday life.
hmm Um, Something that people don't know about me. I don't know. I was born in Virginia,
What part?
in Blacksburg.
Now, where's that from? Like Richmond or oh, I'm trying to think of some other landmarks that I know. Old Dominion University down in Norfolk. That's my alma mater.
Oh, okay. Yeah. North of there. It's north of there. It's where Virginia Tech is. So my dad was teaching there. So I was born there. But we moved when I was a wee one. I think I was 3 or 4. So I don't have like strong ties to the place, but I think, I don't know, it's just a fun tidbit.
All right, so you guys moved out here and then kind of been here ever since.
So then from there, we actually moved to Minnesota, which is where I mostly grew up. And then I came out to the Pacific Northwest for school. I went to school in Tacoma. So
You
that
know
was,
what's interesting is I meet a lot of people from Minnesota and New York that live here. It's really interesting.
yeah, I don't know. I can't speak to New York, but I know from Minnesota, there's a lot of similarities out here. Like, but yeah, in a lot of ways. And then also there's just mountains and ocean here, which we don't have in the middle of the country, obviously. So,
So
but
before we get into speaking about the vaccine a little bit more and the Marvin Williams Center and what they're doing, are there any topics or issues that you're concerned about that you want to kind of bring to light?
um, I mean, and this is where I'm like, this is me as a person, not as a representative from where I work, but I think, just wanting to name the murder of Dante White that happened in Minnesota in Brooklyn Center last night or yesterday. Um, and kind of how that's another example to me of how I'm not sure that police institutions can be reformed, that we're past that point, and that the tools of violence which are deemed acceptable for police officers to use are past the point of reform. And so thinking about how we can reimagine what safety means and looks like in our communities is really important and needs to be happening.
Yeah, absolutely, 100% agree with that. Well, thank you for sharing that thought, and it is tragic that these things continue to happen and at such an alarming rate, right? I mean, I think I just watched on the news there was a gentleman, armed forces person that was just pepper sprayed, got pulled over and pulled into a well lit gas station, and it just escalated. Oh, and this was back in I think 19, but it just the footage just got released, so the officer was fired, and yeah, something has to give. Change needs to come. But I will transition from there. So let's get into the vaccine here. And so you sent me a few flyers here. So I'm going to kind of pull those up here. And the first one that's up here is get a COVID-19 vaccine. Who can get vaccinated? How to get vaccinated? So there's information here. I don't know if this is still up to date, but it's like everyone 65 years old. Can you just kind of talk about what phase we're in, who can be vaccinated now? Because this is an ever-changing situation.
Yeah, sure. So in general, the info on this flyer is correct. Who can get vaccinated, that has changed since this was printed. And actually on Thursday, on the 15th, eligibility opens up to everyone. So the most important pieces of information on this flyer are our website and then the 2 phone numbers on the bottom of the half sheet. Those are for our COVID vaccine voicemail boxes. And so anyone who wants a vaccine who's eligible can call and leave a message on one of those voicemails, and they will get a call back for setting up an appointment. And that's the other thing I want to say is that anyone can do that. But in particular, I think in terms of addressing the inequities in vaccine rollout, like we touched on earlier, if you are a person of color and you want to get a vaccine, call one of those 2 numbers and leave a voicemail. And yeah, that is part of the groups that we're prioritizing in signing up for appointments.
And so typically, if you call and leave a voicemail, when should they probably expect to get a call back?
Typically, it's within 24 to 48 hours, but it just kind of depends. Yeah. So usually it's within a day or 2, but last week we had some issues with our standby list. And so then we had people pulled off of the registration team to be working on standby. So then it took like 3 or 4 days last week, but generally it's within 1 to 2 days.
Yeah, I think that's awesome. And one of the things that I did was I actually did a podcast earlier where I went through the sign up for the Marvin Williams event.
Oh,
Just
cool.
step, because I thought that would be really helpful. Because a lot of times we tell people, oh, just go to this website and just click through and figure it out. So, from a computer literacy standpoint, and then some of the challenges that we've heard about with, I think this is mostly on the East Coast or bigger cities, bigger coastal cities with elderly having access to a computer or being able to navigate. So I thought it would just be helpful to kind of click through and say, hey, this is what this screen says. This is what you click here and go there. And you can always call if you have the questions also. So I think I find that to be particularly helpful. Here's a sheet on facts and myths that you submitted to me that I think is also really important to share. Vaccines can give you COVID. That is not true, correct?
Correct. That's not true.
This is a big one that I've heard, that vaccines can change your DNA.
Yeah, no, that's also not true. And if you want like further information to kind of just more educational materials, information around these different myths, if you go to our website, we now have a toolkit, a community engagement toolkit for folks wanting to learn and discuss more about the vaccines and kind of the whole process. And so I can send you a link to that and you can share it out. But like there's one on there with tips and tools for how to talk about vaccines with friends or family members that you know may be hesitant. And I think that one has some really good tips too, because it's just kind of also, I just want to make a plug for like having those hard conversations, because people listen and respect their friends and family members more than random strangers they don't know in general. And you never know when something you say is going to plant a seed to someone, or even just being accessible and being like, hey, I'm down to talk about this with you whenever you want, I think is really important.
Yeah, I think it is, because a lot of folks have a lot of questions and they're trying to get information the best they can. And it can be difficult. It can be challenging, right? And then even some of the people that we trust. And is this the website here, the kcowa.us?
I can't.
I think that's Kitsap County of, it's at the bottom of the sheet there.
No, that's not it. I'll email it to you right now because I just realized I'm on my phone, so I can't. Yeah, I'm emailing you the link to the toolkit.
Oh, perfect. So, and you know, that's a big issue. And so if you have folks that have, you know, they have misinformation and they're not sure, but you kind of trust them, then, you know, you're likely to start, you know, believing misinformation. So it's incredibly important to, you know, gather information from different resources, but also do your own empirical research and kind of dig through. I think that's really important. Vaccines contain microchips or other tracking devices.
You know, the only microchip you have, you're carrying around in your phone. So no, but there are no microchips in the vaccines.
And this one wasn't, because I'm not a woman, and you know my daughter is only 9, but you know, I should not get the vaccine if I'm pregnant or I plan to have a baby. So that one isn't so relevant to me. But can you talk a little bit about that? Because when I read that one, I was like, oh yeah, I would be pretty concerned about that if that was my issue.
Yeah, I think it's logical that is something that people are aware of and thinking about and concerned about. But I've also heard the flip side where pregnant women are like, I want to get the vaccine so my baby gets antibodies too. And I think they're also still doing trials, and we're not quite sure, but there is some evidence that supports that if a mother got vaccinated after having the baby, she can still pass on some antibodies through breastfeeding, which is kind of cool.
Oh, really?
Yeah.
Oh, that is really cool. Well, thank you for that. And then the last one, I believe, was the single dose Johnson and Johnson vaccine isn't effective, which is the one that I ultimately want because of one needle. Can you speak to that a little bit?
Yeah, and this kind of like brand loyalty to the different types of vaccines we're starting to see more of that. And again, for you, I totally understand if you hate needles, you just want the one and done. In terms of comparing the efficacy of the different types of vaccine, it's really not something that we can do yet. They were created at such different times in the pandemic, and you know, with different amounts of information. And so I know there was some information to suggest that the Johnson & Johnson is not as I don't know, not as strong or as good as the other two, but it is just as strong in fighting cases of COVID to the point of hospitalization or death. Mm-hmm. So again, it's kind of like comparing apples to oranges because they were made on different timelines at different points in the pandemic, and we just knew a lot more when the Johnson & Johnson was created. So,
and what I would say from my personal experience is, you know, having multiple, you know, issues, like I'm morbidly obese, I have hypertension, I'm on 2 high blood pressure medications, I have a autoimmune lung disease called sarcoidosis. And so even with that, deciding to take um, the vaccine to get vaccinated, my only decision on Johnson and Johnson versus the other two is literally just because I only want one needle, right? And it's just convenient because I can just go once and it's done. Other than that, I wouldn't care which one I got. I just want to make that clear. I think that would be helpful for people to understand why you're making the choice that you're making. So with everything that I have going on, I could care less which one it is based on the research that I've done. And I've seen some of the literature on it being maybe a little bit less effective. You said something about 5%. Well, I want to get the terminology right. Carrier or could still be affected. And if I'm understanding it right, Johnson and Johnson might be like 9% or something like that. To me, that's negligible. So get the vaccine. That's kind of where I'm at with that. So yeah, I just wanted to kind of share my own story on that, on because I think that is important. Folks are definitely vaccine shopping, and I've had conversations with folks on that too. So it's like, ultimately get the vaccine that's available. That really is the most important thing. So I wanted to switch to our last topic and get into this declaration from Kitsap Public Health Board. I have the draft. Has the draft changed at all? And am I able to kind of put that on the screen? Is that okay?
Yeah, I don't have a super updated version yet. We've gotten comments, but we haven't gone in and put them all in yet because I think they have to get approved by I'm not sure who, someone before that happens. So yeah.
So how did it come about? Why was this necessary? Yeah, just kind of go into it if you would.
Yeah, so last summer, after the murder of George Floyd, there was a call from community members for the Kitsap Public Health District to declare racism as a public health crisis. And it's something that happened in neighboring jurisdictions and across the state and the country. And it's kind of a public acknowledgement that systems and structures don't have to intentionally set out to be racist and to have racist outcomes for those to be the results. And so just kind of naming that publicly and then listing some of the actions that the health district can take to mitigate or address those things. And at the time last year, I think it was in the midst of COVID response and contact tracing and investigating. And, I didn't work here then, so I can't really speak to that. But I gather that the reason that this didn't happen last year is because of a capacity issue. There just wasn't, everyone who was working was tapped out and working on other COVID response things, which we know is the response that leads to the status quo maintaining itself as status quo and maintaining systems of structural inequity. So the health district did publish a letter to the community acknowledging that anti-Black racism is a health problem and that it impacts health outcomes of Black and Brown community members differently than white community members, but didn't kind of take the next step to declare racism as a public health crisis. And so a month or so ago, I was meeting with some folks from the Erase Coalition, which is the Equity, Race, and Community Engagement Coalition here in Kitsap. And there was a renewed call to action for the health district to declare racism as a public health crisis. And so we brought it to leadership and they said, okay, let's do this. And so we drafted a resolution in partnership with the leadership team, the executive leadership team here at the health district. And then last week, Siri Kushner, she's my boss, She's great. Her and I presented it to the board and they discussed it. And now we have a month to get feedback, and then we'll bring it back to the board for a vote at the May board meeting. And so, yeah, you can see the resolution there. It kind of just spells out a lot of what we know, which is that racism is institutionalized and that it means that there are different health outcomes for Black community members in Kitsap than for white ones. And then the now therefore be it resolved section. So I also learned a lot about, I don't know, this formal official language and process for a way of doing things, which also is a white supremacy norm that cuts out people from understanding and being able to engage meaningfully. But that's another conversation, I suppose.
Well, if you don't mind, let me read a few of these, and then if you would just kind of summarize what you believe this will look like as we're reaching racial equity in this space. So where it says, whereas Kitsap Public Health District recognizes the historical perpetuation of structural racism, and as an institution, the Board of Health stands in support of dismantling oppressive systems that contribute to racial inequalities. Now, therefore, be it resolved that the Kitsap Public Health Board declares racism a public health crisis and supports Kitsap Public Health District immediately in the work to advance the public health approach in addressing institutional and systemic racism, including but not limited to, and I won't read them all, but I do want to read like 4 or 5 of them. An all-staff professional development program to train core competencies in health equity, cultural competency, and anti-racism, establish an internal equity committee, sustaining a community liaison staff position with the focus of equity, ongoing review of existing policies and procedures to address and reform structures and processes that contribute to race-based decisions and actions. And I'll read one more. Ongoing review of health district programs and services through a racial justice and equity lens to identify and implement changes to ensure equity within programs regardless of race. So in your thoughts, what does that look like as these outcomes are being achieved?
Yeah, so the be it resolved section is kind of it's what we're committing to doing. It's the actions that we are saying, these are our ideas for addressing these issues, and this is what we're committing to publicly. And so this is the piece where I want to encourage any listeners to engage on, and I would happily set up a time to talk one-on-one about it, because this is kind of like our accountability document, if that makes sense. So I view the Be It Resolved section as having 3 components. It's what are we going to do to support and uplift community members that, are already familiar with the ways that these disparities show up in like a day-to-day life and like what that means. And so, should obviously be the driving force behind deciding how we address those things. So that's one. Then the second one is what the board members are committing to doing as board members. And because we're a small enough area, our board is made up of mayors of the bigger cities and then also county commissioners. And so it gets a little tricky because they wear different hats. If their particular jurisdiction or city hasn't committed to these things, what they can publicly commit to as a health board member, I don't know. So, and then the third thing is what the health district is committing to doing. So the internal task force that you talked about, that's a task force made up of staff at the health district to talk about and identify health disparities and outcomes in our programs, because we have a bunch of different kinds of programs here and work that we do. Yeah, I think there's small and big things that we can commit to doing, but and so the passage of this resolution is a really important first step, but it's just the first step. Then we have to do all the things we say we're going to do in the resolution,
So let me paint an example for you, and you don't work at a hospital, so I want to make that clear, right? You're not the person that's solving these specific issues. But we had a person share an experience with us who was struggling with addiction, was in a period of being clean, and needed to go to the emergency room for migraine, and was treated as though they were drug seeking. And the only way that they could actually get what they needed was to bring their house mother with them to the hospital in order to, be believed, right? Like, okay, I struggle with these particular issues, but I'm here because I need help, not because I'm seeking drugs. So if people are having those experiences, is there going to be a hotline or some kind of way where they can share those experiences? Because I think there's like advocacies that are already built in hospitals in different places, but the need for this says that that hasn't been effective.
Yeah, that's a really good point and idea. And one of the things that I'm working on trying to set up right now is the infrastructure to be able to hire community navigators, which is the person that I think of when you bring up this particular instance, is people that are already community leaders or, connected to different communities, and then they act as kind of a conduit or a liaison between the healthcare system, whatever that may be, and community members. And so this person could help navigate and say, help kind of communicate that particular example and that person's situation. And don't know if it would work all the time, but would be a step in the right direction, and could work to kind of support those instances.
Well, I think what's going to hopefully make this more effective is, public health is being more outwardly facing, right? There's work that's being done within, but by bringing the community in and saying, hey, this is what we decree, this is what we're committing to, and we want you to help us hold accountable, help us to build this thing in, I think is awesome. And that is what really is going to, how we're going to see effective change, right? That's tangible and really helpful for all communities. I know you got to go here soon. Can you talk about the Marvin Williams event on May 1st?
Yeah. So this past weekend, we had the Marvin Williams Center had their kind of soft open for their clinic that's going to be at the Marvin Williams Center on May 1st, because that was originally when we were told that eligibility was opening up to everyone. So that was kind of our timeline. And the health district has played very much a supporting role. This clinic has largely been set up by Dr. Lillian Lockett Robertson and her kind of team, her crew that she's activated. And they vaccinated around 100 people, and it was also just meant to serve as kind of a informational, educational event so that folks who have questions about the vaccine and the process and kind of some of the things we've talked about, like the hesitancy issues and what's in them and how do they work and what can you expect. And so that was kind of a warm-up round for the May 1st event, which is going to be, I'm not sure how they're doing registration, and I can check with that and get back to you. But it's going to be a much larger event. And because it's a space that the Black community in Bremerton and Kitsap is generally familiar with, it's meant to serve that population, and it's predominantly Black physicians and healthcare workers that are administering the vaccine also, and available to answer questions. So that I think Dr. Robertson says, by us, for us. So it's and by us, and it's for us. And so, anyone who's holding out, that would be, I think, a really special place and time to get vaccinated.
And we are, Gather Together, Grow Together, which is my nonprofit, is partnering with the Endeavor. And so we are offering free transportation to anyone that needs to get the vaccine. So we will pick them up as long as they're in Kitsap County, bring them down to the Marvin Williams Center, get their vaccination. When they need to return, either 3 or 4 weeks, whichever one they get, then they'll be able to get that transportation for free also. And we're also partnering with other organizations, to help them out and really kind of, reduce the barriers for folks to get vaccinated. We're going so far as to, loan out some of our vehicles for some of our non-English as a second language speakers, because there are trust issues kind of built around, different things that are going on. And so if what it is you need transportation, but you need someone who, speaks your language, and that's what's going to make you comfortable, then let's remove the barrier. And so that we're just trying to increase the access in whatever space that we can do that. I can say that I believe on that day, there's going to be lots of different resources that are there also. So it's a good idea to come down, because even if you're not getting vaccinated, there will be experts there that can answer questions. If you're on the fence and you just want to come and talk and just kind of see the process, all of those things are information, right? So you get to see it in real time as it's going on, and not taking it as hearsay of what you've heard on mainstream media or through different pockets of where you get information. I think that's really powerful. And if you're interested in that, whether you're getting the vaccine, we'll extend that free transportation to that too, because I think that's really important. If we're working toward herd immunity, reopening the community, reestablishing jobs in the economy, all of these things have a health issue base. I think all of it is profoundly important. I'm going to give you the last word, Holly. I really appreciate your time. I do hope you will come back. How did you think it was? Was it as scary as you thought?
Back for a part 2. It wasn't as, you didn't grill me as much as you could have. So
no, I think the most important thing is to provide information, right? That really is it's accessibility. And this is the conduit. That's really what, I created this for, is to, again, remove those barriers and create a space for people to have conversations with public health officials that they wouldn't normally have conversations with, right? And be able to hear from them. So yeah, I'm gonna give you the final word, and I want to thank you for your time, and we really appreciate you.
Yeah, thanks, Marwan, and thanks so much for having me. I do think any kind of outlet or channel that we can be providing information and answering questions, and then also feel free to share my email and phone number with folks. I'm happy to chat or talk more with anyone who's interested. So yeah, thanks for having me, and thanks for all the work that you do.
All right. I will absolutely do that. I really appreciate you. That is Holly Bolstad, everyone, from Kitsap Public Health. We do thank her for her time. She is awesome. And so there again, I think, the purpose of this podcast is to do a lot of different things, but it really is to open up communication, in a two-way form, right? So for folks to get information from people that they may not normally have access to, as I said before, but then on the other side, for people who don't have that access, to hear from those folks. And that's why it was really important for me to tell the story about the person that had that experience in the emergency room, because she's never heard a story like that before, right? And maybe they look at it as a case study on what they should do, but this is the reason on why a declaration would be created. And just kind of further thought on that. Good things can come out of really bad, tragic situations. And so as she was sharing, this came about because of the murder of George Floyd. And differences are being made, right? To where public health is creating these declarations, or looking at their internal processes and their personnel and wanting to make an active difference, right? Is it going to change overnight? Absolutely not. Will it get better? Yes, I do believe so. How much so? It just depends. But I think that will depend on, us helping to hold them accountable, right? Sharing our experiences, and giving grace where it's due. to allow folks to grow into a space of being able to provide the services in a non-biased way and to move forward. And for the most part, I think there's a lot of change that's going to need to happen, right? You're talking about institutional um, discrimination and everything else that exists. To dismantle that is not going to be something that is done overnight or in a vacuum, or you're not going to see that kind of change that happens just like that. So it's going to take diligence. It's going to take people being involved. I know that there are a number of people that I know that sat on the board this letter was taking to, and these are folks that didn't always sit on these boards, right? These are everyday people. So it really is an opportunity now for you to get involved in. We get involved in many different ways. I say it all the time. You don't have to, be a part of a nonprofit or an organization. You can do it yourself. But go and sit on boards, go and listen in on committees. When they ask for feedback, provide that feedback, because what happens is the people that do take the time out to provide that feedback, to make their voices heard, usually get what it is that they're asking for, because they're the only ones that are asking for it. And we know that there are a lot of different reasons on why other voices are drowned out, but a lot of it has to do with us feeling so disenfranchised that it's like, what's the point? It's not going to matter. My vote does not matter. My voice doesn't matter. And so therefore, I'm just not even going to bother with it, right? Nothing is going to change. And so I think this really serves to show that is actually not true, right? That change may be slow, but change gonna come. And that is if we put the work in, right? We cannot stop now. We got to continue to forge ahead, and to make the differences in the community and in the spaces that we want. For those of you that have children or loved ones that are younger, some of these things may not be for us, right? They may be for our children and our children's children. So we do have a fiduciary duty to do that. And if we are patriots, then I think we also have a duty to, improve our country and make it a better place to live for ourselves and our family and our friends and everyone else too, right? So like I said, that was Holly Bolstad. Great interview. Glad she was able to take time out. She said she only had an hour. I'm like, okay, so I'm gonna have to ask her all these questions that usually take about 2.5 hours and go into public health in an hour. So that's why you got the rapid fire questions. I am amazed that I got through that. I was like, all right, I'm gonna have to dump a bunch of these questions to get through it. But we appreciate her coming out. Please go over and check out YouTube for our videos and the Gather Together, Grow Together page, because that is where our Facebook program is going to move. It's going to move from my personal page over there to the organizational page. So please go over there and subscribe and like and share this information. Again, I will make Holly's information available. Maybe I should do that now before I get off, so it's there. It'd be a little bit more difficult to do in post. But if you do have questions, concerns, things that you want to have added, please do that. She is asking for that. And again, it's 2021, guys, and it feels different, right? People are being more open. They're wanting to be collaborative. I mean, there are instances where you can scrub a website looking for information and you can't find it, right? You can't find a person to contact to ask questions or comment or whatnot. And so I think we've got to take a look at that, right? And while we are making those gains, just as Holly said, right, we're still seeing, police brutality that's happening in this country. And man, there's so much that has to be done. It's so very exhausting. So very exhausting. But we got to stay the course. Got to keep putting the work in. And we can do it. We can do it. So find your space. Find multiple spaces. Let's make a difference. We can do it. That sounds so cliche. It doesn't have to be. All right. As I said, I'm getting the number and her email so I can put that up so that you have it. I think that's awesome. And it's been so interesting to have these conversations with folks that have been wanting to get to this point, right? So again, that is Holly Bolstad, COVID Program Community Liaison at Kitsap Public Health. Her phone number, 360-728-2235. You can reach her at holly.bolstad, BOLSTAD, at kitsappublichealth.org. The main website is kitsappublichealth.org. So that information is there for you. Again, Marvin Williams has a big event coming out May 1st. So stay tuned on that. I will definitely be putting out information and talking about that pretty often. Also, the new rental assistance program has officially started here in Kitsap County. So again, if you need help with eviction protection, please give us a call, 360-373-3000. Go ahead and get on our schedule. Let's start filling out that paperwork to get you some help with your rent and your utilities. And that goes for both tenants and landlords, right? So if you have a tenant, landlords who are behind on their rent and you're looking for some relief, please give us a call. We can help you out. If you are a homeowner and you're trying to pay your mortgage, you need to contact KCR directly, as they have some programs over there for you. And again, for the vaccine or for transportation, we are providing that for free, 360-373-3000. As such, we're always looking for more drivers to hire to help ensure that we get everyone to where they need to be. So reach out to us, the same number for all of those needs. Again, you can follow us on YouTube at Marwan Cameron. You can follow us on Facebook at Gather Together, Grow Together. So please follow us over there. I will be back probably tomorrow. But in the meantime, our video library is over on YouTube. Go ahead and check that out. I hope that you have a wonderful day. I'm Marwan Cameron. This is The Conduit. Have a good one. Be good to each other.